HIV and AIDS has claimed many lives in the country. Even though the fear associated with HIV and AIDS has changed with time due to the many preventive interventions, health experts say the disease is still a public health threat and intensive advocacy is needed to reduce the rising figures at all levels. The National AIDS Control Program says majority of the populace are still unaware of their HIV status. From statistics, only 21,600 people are aware of their status. Additional figures also show that 18,982 HIV infections occur in young adults and adolescents from ages 15 to 24. Of the 19,000 new HIV infections recorded in Ghana in 2021, 5,200 occurred in females, a situation both the NACP and the Ghana AIDS Commission say is worrying and must be tackled from the root.
At the last count, when we took children and adolescents, about 5,200 new infections occurred amongst the children. Now, what was very intriguing and very surprising was that majority of them were females. I think it follows the general picture where of the population of people living with HIV, the females are more. Okay, females are more. About 70%, 65. I mean, females are more. So, new infections also, we notice that the females are more, but about 5,200. Okay, and you will find a similar trend with respect to those who died.
Health experts say transactional sex, poverty, and the exposure of the female anatomy to contracting various diseases are some of the leading factors of the rising HIV cases among females in the country. In reducing the rising figures to its barest minimum, the National AIDS Control Program and the Ghana AIDS Commission have introduced some measures.
Recently, there's even what we call the Education Plus initiative, which is about advocacy about young ladies staying in school, because it has been realized that when you stay in school, there is a kind of structural benefit in which the number of HIV infections in that group goes down. So they are pushing that agenda with the UN system.
Then we have one intervention with the school health. We call that with the SHEP, School Health Education Program, where continuously we update the curriculum of schools with HIV information so that whilst they are in school, they learn HIV as a normal subject. And by the time they become adults, they have some ammunition to prevent them.
HIV and AIDS advocates are sending an urgent health alert to the general public to ensure females, especially those of school-going age, are protected. They are calling for intensified and routine education on HIV and AIDS in all second cycle schools and universities across the country to stem the spread. Beatrice Sanaju, GBC News, Accra.